Hi everyone. Well, we'll kick this off if you're all okay. I'm Deborah Henderson. I'm a patient advocate from Australia. A few Australians here, and I've been a CLL patient for 14 years and had 6 lines of treatment. What we're talking about in this group today is strategic fundraising at scale. And I'm delighted that we've got Marianne I'm going to try it, Van Maarschalkerweerd. Thank you. Um, from the Netherlands, Marianne discovered she had CLL in 2010, and after treatment in a clinical trial, became a dedicated patient advocate with Hematon. Is it Hematon? Hematon, the National Haematology Patient Organisation. She plays an active role in haematology working groups alongside clinicians, helping shape guidelines and treatment protocols. Today, she brings us perspective on how organisations can align people, resources, and goals to strengthen fundraising at scale. And over to you.
Thank you very much for this introduction. I'm indeed a patient myself, and luckily I've been treated only once in 2018, and since then, no symptoms and no treatment anymore. So I'm a lucky one. What I would like to do today, the organization asked me just, I think, last week to step in, and I would like to use what the chairman said, learn from each other. So I would like to make it a very interactive session, not really a presentation from my side. I'll give the objectives that was stated for this session, a few ideas from my side, and then I would like to open it and have all your inputs, because I think I'm not a fundraiser myself. Did some of it. I think we have more people who are experienced in it, and you learn most from each other. And what you have to, at least what I realize, is what is allowed in my country may not be allowed in your country. So it's all very, let's say, personal what you have to do. I have to do it myself. The objectives for this session were given by the organization. They said, how do we identify opportunities? And what is an opportunity with a high potential? Because you can do everything, but what gives you most? Thereafter, we would like to see how you align goals with resources. Of course, when you do it, you want to track what is happening along the way, and also learn from what is happening, the good and the bad. And maybe we can share some experiences from the different people here in the room. What I also realized when I saw this is for large organizations. I have no idea what a large organization is. Where is the definition? So my next question is, and I'm just going along just to have an idea of what we're talking about. How large is your organization? Do you have many departments that have to decide? And do you have paid staff? Because I think that are the things that depend how much you can do. And I just go along, and I think everybody's.
Okay, I'm Rita Christensen from Lille. Our organization is about 1,350 members, and we have only one department, one board, and we don't have any pay staff.
Hi, I'm Jennifer from Blood Cancer United, formerly the Leukemia and Lymphoma Society in the United States. We have over 1,000 people. I don't know the specifics. I apologize. We have many different departments, even within fundraising. And yes, we have paid staff and volunteers.
Hello everyone, I'm Jenny from China and based in Beijing. Our organization name Maarschalkerweerd, and our organization actually support over 150,000 lymphoma and CLL patients. But for CLL, we service for 2,050 of 500 people. And we have 6 departments. And for our organization, there are 14 paid staff. And of course, in 2020, we also founded a charity foundation named Home Charity Foundation and expand our horizon. So we have another 16 paid staff support other 5 diseases, including leukemia, childhood leukemia, multiple myeloma, and also 2 different kinds of rare disorders.
You have a lot to coordinate.
Hi everyone, my name is Jung Kim from KBDCA Korea. Our association operates with about donations totaling 78 million in USD and are employing about 25 staff members and all of whom receive salaries. And also we work with about 50 pharma, global pharma.
My name is Ron. I came from Israel, and my organization is called Fruit of Light. We started before 25 years ago under the direction of the master, Giora. And we have 7,000 members for all the blood cancers.
Hi everyone, my name is Andrielle and I am representing the Max Foundation. So we are serving about 40,000 patients year after year. The majority of those patients are continually receiving help from our organization. Despite that large number, we are a lean team, I would say. So we have about 100 employees who are paid staff. A certain number of volunteers across different regions of the world. And our makeup is really 25% of our employees are based in the US where our organization is headquartered. The remaining 75% are based in the regions and countries where we are serving patients.
Yeah. Hi, my name's Raymond Vless with CLL Canada. We're a small volunteer-based organization. When we need funds, we ask pharma and it's for projects. So I'm just a tourist here listening in and seeing what you're saying about fundraising.
We might learn from you as well.
Hello, my name is Elena. I'm representing a Spanish organization. We are an umbrella. We got association all across Spain, and we got some pay staff, and most of us are voluntaries.
Hi, I'm Lauren from South Africa. We are a pan-cancer organization, so we deal with as many a patient advocacy group. So we look at a lot of patient policy work and that, but as we've seen now, one of the things that we do look at is integrating disruptive projects into the system. And then sometimes the system will take over and run those, or we'll do that. And then we have 16 paid staff members, and we don't work in departments. We work in job function, like in functions. So we have cross-functional. So it's everybody's job to fundraise. And yeah, we have been working for 16 years, and we work across the country, and most of our fundraising is through grants and with pharma. But what we've also done is taken some of our services that we provide for oncology and put them and partnered with rare diseases who also provide certain services, and put them out into a for-profit company to charge for other disease areas, because we have a select set of services that no one else in the country can do.
You always started to share.
Hi everyone. I'm here with two hats on in my capacity with CLL Advocates Network. As you all know, you're all members. We have 55 members in 45 countries. We're a small team. Myself and Myrna are paid staff. Everybody else are volunteers. And my other hat is I'm chairperson of CLL Ireland, completely voluntary, similar to Raymond, I think, in terms of project-based funding. We have aspirations for paid staff at some point, and fingers crossed I might learn something today that helps that. Thank you.
Yeah. Hello all. So I'm also from the Max Foundation. I'm Shalini, and I hope you all know me very well now because this is I spoke about our organization yesterday. And as Andy said, we are all over supporting patients, and yeah, we have paid staff, and we have a lot of volunteers who support us to excel these programs.
Hi, I'm Kathy from Max. I'm not going to add anything.
Hi, I'm Leila from Tanzania, from the Blood Cancer Foundation of Tanzania. Our group is not that big and we are all volunteering. We have 11 co-founder members and up to 10 volunteers. So we are all volunteering to do this work. No one is being paid. And up to now, we have at least a registered patient 157.
I'm Liselott Eriksson. I'm with the Blood Cancer Organization in Sweden, Blood Cancer Forum. We are just a small organization, and we have been doing it until now just on volunteer basis, but we are working on to get staff, to get our first staff, but not yet there.
Thank you.
So I am here under the auspices of the Leukemia Foundation of Australia, but I don't work for them. I'm a volunteer. I do a lot of government advocacy and help patients. But my background is I was head of fundraising for one of our major political parties until I was diagnosed, and then I now work in the think tank space. So we're the main economic and public policy think tank in Australia. In terms of the Leukemia Foundation, I've just quickly looked at their annual report. They've got 50 paid staff, a budget of 15 million euros. Quite a lot of their staff are in the fundraising department. It's a major push, and to reiterate what my colleague said up there, fundraising is a whole organisation objective, and no organisation will be successful unless everyone realises that's the primary function of the organisation, because without money you cannot help patients. But I'm also on Cancer Australia, which is the government body responsible for all cancer policy. That is a paid role, appointed by the Prime Minister of the Department of Health. And I'm also on the government's blood cancer task force. So I do a lot in the political space, I think is my background, and I'm a trained journalist.
Hi everyone, I'm Peter Allen. I'm with CLL Support UK. We're probably, as a small organisation, we are voluntary led primarily. We have two paid members of staff. They work part-time, and everybody else there is volunteers. We've got about 4,000 members or subscribers to our services, and we have funding a range of different sources, but it'd be nice to find a way to make that more sustainable. It feels each year we have to try and get our budget to match our funding. So yeah, really interesting discussion.
Thank you all. Just I'm finalizing it. I'm from Hematon. We are a voluntary organization. We have about between 6,000 and 7,000 subscribers. We have, when I started in 2018, I think we had half a member paid, and we now have 4, mostly part-time, but let's say more than half of their time. So we've been growing considerably. And what we did is in 2012, we merged from 4 former organizations for all kinds of different blood cancers to one organization, and we now deal with more or less all the blood cancers, including lymphoma, myeloma, etc. And that helped us enormously in a small country where you have to push a bit. And now we all have our preferences, of course, for your own disease, but we are geared to get all the information we need and all the push we can get. So, what I, sorry, aspect I could think of myself that we have to take into account later on when we go around, what kind of fundraising do we know or do we use? Do we mainly look at project fundraising, because that's quite often the easy way to do it. But when your project funding then stops, what happens then? And how can you change that into a more sustainable fundraising? Further, what are the rules we apply? I think we get, and maybe for you the same, from all kinds of sources, quite often pharma, they want to do something for you. But how do you keep it in your own hands? Because it's important for you, not for the other party. And how far do you go in deciding what is possible and not? The other thing, and that is especially in larger organizations, I'm curious to see, we are quite small with 3 departments, so that is not that difficult. Who takes the initiative? Is that the board who decides on the yearly plan? Or is it somewhere who has a nice idea? Or where do you start? Further, who are our partners in fundraising? Is that the government? Is that a cancer organization? Is that whoever? Or is it more what you do today to get funds to start an action for one way or another? Then when you have some nice ideas, there might be 5 ideas that are worth going for, but you have to make a choice, because if you don't make a choice, then you end up with too many things that you don't do properly, and it will not have the impact. And impact is what we would like to have. Then how do you measure impact? Is that the main reason you do something? Because you want to have impact on, for example, policies or governmental policies. And we can use examples how to illustrate some of these points. I'll follow the first objectives that I showed before, the 4 objectives. And I would like to start with, how do we identify and prioritize, especially in larger organizations? I'm interested, or probably all interested. Someone already said fundraising is something for the whole organization. How do you make sure that the organization is behind that one goal that you want to achieve? Because there's a lot of things that you want to achieve, and the communication department probably has quite some different ideas than the advocacy, and the people who do the patient interactions have different ideas. So where do you start? And do you start from the top, or do you start from the bottom? Who has some thoughts about it? I know that I put you on the spot, but we are here in a safe environment, so that shouldn't be an issue.
I think it doesn't matter if you're small or a big organization. You first have to understand, why were you established? What was that trigger moment and the need you identified of the establishment? And that need usually drives you towards a strategy. So the one thing I find smaller organizations don't often do is develop a very clear need assessment or problem statement, and then identifying the solutions. Because if you can identify potential solutions, then you develop a strategy. And that strategy isn't usually short term. It should look at the horizon, again, you use the word, and long term. And there, accordingly, you develop your mission, vision statement, and set across to what your plans are. And then you need to fundraise, not for what you need today, but what you're going to need for the next at least year, 2 to 3 years. We are in small organizations, often very short-sighted. We look at a project cost, but that doesn't lead to sustainability, because once those funds are gone, how do we set up the next program? We often also just fundraise for the event, like the t-shirts and the transport and the show. But who's paying for the telephones? Who's paying for the staff or the extra incidentals? So I think, first of all, going back to the start is, what is your need? Why did you start? What is it that you set out to do? What's your strategy? And then align your fundraising accordingly.
How do you decide at a certain moment when you have really that strategy, but someone else comes on with a really nice idea, but that will direct away from your goal?
That's a hard question, because I'm the one that usually comes with the ideas, right, Andy? I'm the one that usually wants to come up with the ideas, but I've learned as well that there's a time and a place for every idea. Once we're on track to achieve something, yes, we need to be open and flexible, but we also need to understand everything in the organization that works towards this goal needs to be realigned. And are you going to invest the time and the additional funding to go towards this idea, or are we keeping on track on a more sustainable pathway? So there's a toss-up, but it comes towards, I think, co-creation, working together with your team. That's the other thing I find, is organizations are developed around an individual. That is never sustainable. If you set up an organization, you need to have at least a dedicated leadership team or a committee that works together. So if somebody drops out, which is usually the patient, then there's another team that can go on. And we need to be able to understand and listen to each other, and be able to take criticism as well for our ideas.
Who else?
Okay. I believe that we start from the buttons. We start before 25 years ago with only the CML, and after that we got up from CLL and the other blood cancers, and we have some target, and the one of them we call it in my organization the Holy Trinity. The Holy Trinity is some educations for this order. One is the patients, the two is the doctor, and the three is the organizations. And we education to speak each and others, and that is belief. And we have some mentor plan, and every patient that he wants, he get some mentor with this language. The mentor spoke with the patient in his language and his disease and his age. It is wonderful. It is more easy for the doctor.
Thank you very much. For a large organization,
So I think our organization started with 2 people working on our computers on a couch. We then went 2 people working in a boardroom that we borrowed from some lawyers, and we've moved up, and now we sit with 16 people and those projects. And I think the one thing that I've learned after doing this for 20 years is that patients are sold a lie when you create a patient organization, because you think you're getting in to do this for good and to help patients, but you're not. You're creating a business. You're creating a business. You get held accountable. Your business, your organization is registered like a business. You get held accountable to that business. You get held accountable to the accounting, the economics of business, everything. And if you don't run your organization like a business, you can't, as you said, can't provide the services. So thinking that you're getting in this to do something nice for patients and to help patients, they're lying to you. You will spend most of your time running a business. That's what I do. I run a business. And I have to make sure that that business is sustainable, and I have to make sure that that business can answer to the people that gave money. Now, if you go on this mindset, so the first mindset that we had when we started this organization, and it came from our board of directors, is everyone gets paid. From the beginning, everyone got paid. I don't get paid a huge salary, but I get paid. And the reason for that is because then everyone takes everything serious. And I'm not saying that volunteers don't take it serious, but your accountability still lies there. Therefore, you must be paid for your accountability. If you do something wrong, you're going to land up in court. You're going to be held responsible for fraud. You must be paid for that risk that you're taking. So that was what our board said: is everyone gets paid. Okay, nice for them because they don't have to raise the money, but it was a mindset that started from the beginning that this is a business and this is what we work as a business. And the one thing that I've always said is that if we hadn't had that, we wouldn't exist today. Because it made me sustainable, it made everyone else sustainable in the business, because they work, they've got a job. They don't have to go and do another job to pay their lights and water and their rent and only do this half the time. Everyone is invested 24/7. That's what we do. And that's. So now when I speak to a donor and the donor says to me, "Oh, I want to do this," I'm going, "Okay, this is my business. If it was your business, would you do this?" And when the pharmaceuticals come to me and they say, "You want to do that?" I'm quick to say no. And when they say, "We only pay for project costs," okay, that's fine. We'll pay for the project costs, but we don't pay for staff. Oh, okay, that's fine. We'll do the project. Then they phone me and they say, "But why is the project not happening?" "Well, you won't pay for the person who's going to type the email." So if I'm sending the education material, someone's got to send that education material. So if you don't want the person to send the education, I'll develop the education material and it'll sit there on a shelf. And those are the conversations you have to have with donors, because they don't understand. They do not understand that. And as soon as you start putting it forward like that, you say to them, "Would your marketing department work with no budget? Would your marketing department work with no marketing manager?" Okay, I tell you what, you just leave all your marketing to your ad agency and you don't have a marketing manager. Off you go, see how that goes. And when you start putting it in those mindset, they come back to you and they're like, "Oh, we insist. Oh, you want a report? My compliance wants a report." You want a report? That's fine. 10% of the grant is for reporting money. I'm not even, don't ask me what I do with it. It's your report, so that you get a report at the end of the day. These are like, you've got to be hardcore with donors, because they don't understand how to run it and they don't understand what you're going through daily to keep this organization going.
Yeah, and the service that you give to patients is free for patients. Yeah, okay. What I'm wondering is, how do you get that first money to say you are all paid? Because I wouldn't say that I know how to get it.
So the first thing that we did was we work on a system where we managed to get a lot of donations in kind. So this was part of the hard conversations that we were having. So if a pharmaceutical comes to me and says, "I want you to do education material," so that's fine. Then I go to an ad agency and they give me the stuff in kind. I take the money that the pharmaceutical company gave me and I put it in unrestricted funding. Because why must the pharmaceutical get the benefit of the in-kind donation from the agency? I get it. As the NGO, I get it. And I tell them, "Look, I delivered it. Here it is. They did this," and we keep track in our books of in-kind donations and that, and it's at value, at market value. So now I'm moving money that the pharmaceutical would have said was for printing, but I got the printing donated. I'm moving that money into a salary.
What I'm wondering is, if you have more staff, who then decides? Because we had more staff over the last years, and then some of the volunteers said, "We are getting too professional. They don't feel at home anymore." So how do you deal with that kind of things? Because everyone has to feel at home in an organization. And I know growing goes with growing pains, but how do you deal with it? I think you wanted to say something,
Yeah.
Barbara?
My point was, I see a lot of, I work with a lot of charities. I help as a volunteer. And I see a lot of charities spending a lot of time when they could make and not just because I'm a fundraising professional, paying someone to do your fundraising is the first person in the door. And a professional fundraiser, their key performance indicators are that their salary should be no more than 20% of the money they bring in. So if you can find that initial 20%, you will then turn that, $80,000 salary fivefold. And that is your springboard to everything. All the, t-shirts and the afternoon teas and using a lot of volunteer time on very small fundraising efforts. It's counterintuitive because it's wasted energy. Your founder, CEO spends 70% of their time fundraising when they could be doing the strategy and having that time to grow the organization. You have to find professionals. Yeah.
But and who decides on the projects? That is still the organization.
They're still the organisation, and the fundraising professional reports to the board, and but then you've got long-term planning, so you can have I deal with in our organisation, I deal with corporates, I deal with high net wealth individuals. I never allow single annual donations from high net wealth. We lock them into 3-year, 5-year. It's part of our strategic plans. These are projects we're supporting because all our projects involve staff. We have researchers, and we have to pay researchers, and we now legally cannot just put people on 1-year contracts. So I can't just take funding for 1 year. But that means for the next year, as long as I've looked after the donor, all I'm sending is invoice for that donation. It's already committed.
Yeah, I have a question. Where do you found this professional?
Yeah, no, it's a really good question.
Where are they?
No, I think it's actually easier in the cancer sector to find them because there are passionate individuals who've been touched by cancer. Try and find them I'm in conservative politics. Try and find them in politics. It's very difficult. But in our space, there are people who have been touched by cancer, have lost loved ones to cancer. You advertise and you interview people. It's a job. And honestly, you will reap the benefits very quickly from having that paid member of staff. So even if you're an organization now with one paid member who might be the CEO, the next person has to be the fundraiser and the accountant.
Yeah, I hear what you say, but working in another organization before in Sweden, blood cancer organization, we tried actually a lot to hire them, but it was just impossible. They just wanted to have high wages, but they didn't bring anything to the organization. So where do we find them? That's, I think, the issue.
A bit further. I just heard that I will not be able to finalize all these things because we have only 5 minutes. But I think we at least got to know each other and can talk a bit more also tonight during the dinner.
Yeah, one comment then, because the time is running. You can actually in AI put in that which funds are available for you can fundraise, because we use so many resources on finding the funds who are giving money for these kinds of illnesses. But you can do it on AI and you can find the one.
Yeah.
I have people that have moved from one pharmaceutical to the next, and every single time they go, they give me funds out of that pharmaceutical. So I have to make sure that I have relationships with the organization and the individuals. And I mean, I was telling everyone that I'd been to Barcelona and all that. I don't go to Barcelona for the clinical data. That's not my job. My job is to go and look, where can I find opportunity to find funding for at every single global conference. So that's my job, to look at the strategy for partnership and to look at that. I send other people for the clinical stuff on that.
Thank you. I think we have not covered enough ground, but I think that's what you have in a short time. What I take from this session, correct me if I'm wrong, is that fundraising, you have to do it in a professional way, because otherwise you will lose a lot of time in thing. And organizations have to find that way to do it. What we also said is, if you want to fundraise, first you have to really step back. And what is the most important aspect that you want to have for the next 2-3 years? And go for that. And don't, because if you have too many projects and not enough staff or not enough volunteers, then you do things, you lose a lot of time and you won't come where you want to be. But keep a good eye on it. And I think learn from each other. I think there are several people here who have a lot of experience. So talk to them because we didn't. You can't cover everything in one session, but I think that's important to realize what you want, get the whole organization behind it, and then really take it on. So I think that is where I have to stop here. Sorry, I would have loved to go on like everybody else, I think.